looking at the United States as a whole, Black women have higher maternal and infant mortality rates compared to their counterparts. Some statistics show sometimes 3 to 4 times higher than their white counterparts. And it's an experience that most people view as like a joyful one, but it is oftentimes not the case. So just wanting to be able to address those disparities and really challenge some of the systemic barriers that exist for improving maternal health. A lot of the deaths we see in maternal and infant mortality, maternal mortality mainly, are things that are preventable. They're cardiovascular issues, hemorrhaging, issues, complications related to hypertension, infection. All of those things are preventable, but because of the way the systems are set up, whether they're systematic racism, medical bias.
Hey friends, welcome to Public Health Careers. I'm Omari Richens, founder of the Public Health Millennial and host of Public Health Careers. Join us as we dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies to help you learn, navigate, and transform your public health journey. On today's episode, we have Najma Dahir. Najma is an internal consultant 3 at a large health insurer. She conferred a bachelor's degree in global studies and a minor in public health at the University of Minnesota, and is currently pursuing a dual master's in public health and social work degree at the University of Minnesota School of Public Health. In today's episode, you'll hear and learn more about how the immigrant experience shapes her perspective on health and public health, the importance of grant writing in public health and how she's able to gain this skill set, why listening to community needs is essential for ethical research, how hobbies play an important role in maintaining your well-being, and much, much more. Be sure to hit that subscribe button and enjoy today's episode.
Hi everyone, my name is Najma Dahir. I am a Black woman who identifies as a refugee immigrant currently living in Minnesota. I am also very passionate about public health and addressing health disparities.
Welcome to the show, Najma. I'm very excited to have you on and to hear a little bit about your journey and how you got involved in public health and what you're planning to do.
Yeah, I'm excited to be here. I absolutely love the podcast, so it's a great opportunity.
That always means a lot when someone says that, so I greatly appreciate that, and I'm glad that you're here to tell your story and contribute to the podcast and contribute to just helping others understand public health. So jumping into, you shared a little bit about how you identify, but tell us a little bit about more of your personal background.
My family migrated to the United States when I was 3 years old from Kenya, but originally from Somalia. And I've been in the state of Minnesota majority of my life. And I went to school here. I went to Minneapolis Public Schools, and then I went to the University of Minnesota for my undergraduate degree. And then I'm currently there pursuing a master's degree as well. My journey to public health has been very interesting. It's been somewhat linear, but I'm happy to get into that a little bit more later.
Yeah, absolutely, absolutely. Well, I'm looking forward to diving more into that and how that intersects with your perspectives and lens in public health. But before we get into any of that, I would love to just get some easy questions going. So you have a grant professional certificate from Spark the Fire grant writing classes. So I'd love to know what was the maybe inspiration for getting this and what did you gain from doing the certification?
At the time that I pursued that certificate, I was working as a managing grants and contracts for community-based organizations. A lot of the experience I had was working alongside communities to implement initiatives using funding that would be provided by the county I was working for at the time, Seattle-King County Public Health. And through that experience, I realized that the grant process is not always as clear to community members, and even to myself as a professional. So that kind of inspired me to gain some background knowledge on what it's like to actually write a grant, apply for a grant, learning about the budgeting process, learning about writing a grant narrative, just so that I could be a better advocate for the communities I was working with. As far as takeaways, getting the grant writing certificate has really improved my writing skills, but also my general knowledge about grant funding, whether it's federal, state, local level. So those are some of the things that I benefited. And this program was through Seattle College at the time.
Yeah, that's awesome. And I think it is a skill that is very needed in public health or can be very useful in public health, but yet we oftentimes don't get the training in that. I remember the first grant that I wrote was after my Master's of Public Health program, actually. And I think we did get it. I want to say it was like a $15,000 grant to support the community health needs assessment work that we were doing in Alaska. But I've seen how important and fundamental that can be. So that's awesome that you were able to build that skill.
Yeah, I think a lot of the takeaways for me also were about making the grant process equitable. Like you mentioned, writing a grant is one thing, getting the grant is another thing. But how do we make sure that we're allocating resources fairly to the communities that we're serving?
Yeah, absolutely, absolutely, and I like your perspective also of sharing that you got into this because you wanted to share or understand better the grant process so that you can support the community in that, because many times it is the communities that are most marginalized that need this type of support but just don't know how to go about getting the support. So that's awesome. And I believe you'll also get your Master's of Public Health with a concentration in maternal health. So I just wanted to dive more into maternal health for a little bit and learn more about your perspectives on the disparities, failures at the systemic level, and how we can make childbirth more equitable.
Yeah. So most of the programs that I've worked with throughout my public health career have been focused on improving the health and well-being of families and children. And pursuing the Master's in Maternal Child Health was inspired by multiple factors. One, just what I've observed in the surrounding environment around me. As somebody who grew up in a marginalized community, refugee immigrant population, seeing the birth outcomes and the complications that come during childbirth for individuals I know and in the community at large, but also looking at the United States as a whole, Black women have higher maternal and infant mortality rates compared to their counterparts. Some statistics show sometimes 3 to 4 times higher than their white counterparts. And it's an experience that most people view as like a joyful one, but it is oftentimes not the case. So just wanting to be able to address those disparities and really challenge some of the systemic barriers that exist for improving maternal health. A lot of the deaths we see in maternal and infant mortality, maternal mortality mainly, are things that are preventable. They're cardiovascular issues, hemorrhaging, issues, complications related to hypertension, infection. All of those things are preventable, but because of the way the systems are set up, whether they're systematic racism, medical bias. There was recently a study by the New York Times that cited studies that showed Black women were 25 times more likely to receive medically unnecessary C-sections. Things like that just kind of are frustrating. And I'm a naturally curious person. I'm always asking, why do these instances keep occurring? What can we do to make it better? So that's some of what shapes my interest and outlook for pursuing maternal health.
I appreciate you sharing that, and I love the lens of taking it from the prevention perspective and understanding that there is so many ways that we can prevent a lot of the things that are happening, and how do we address those systemic inequities that lead to the outcomes that they are there as well. And it's interesting, the C sections thing, which is very sad. Before I knew the word public health, I was doing my bachelor's in biology and I actually did a project on looking at like health outcomes of having like a C-section birth as opposed to like a vaginal birth, and the type of bacteria and the outcomes that come from that. And of course, there were disparities there, but I didn't realize that that was like public health work until afterwards when I was getting my master's of public health. But just understanding that there's so many like intersections in where we can prevent and support people and families, which is so important.
Yeah, you mentioned a really good point about like you didn't know it was public health work until you entered public health and you can make that connection. That's another area that I'm really passionate about when it comes to maternal health, understanding, like you study biology, but the genetics behind how individuals might be predisposed to diseases. Why are some of these outcomes happening? How can we prevent them? I have a very interesting like I have a very big interest in the research aspects of epigenetics related to maternal health. Things like where individuals live, the environment that's surrounding them, the air quality, the access to adequate housing, adequate and healthy, nutritious foods. A lot of communities of color live in hospital deserts and food deserts. How are those things impacting birth outcomes for future generations? There are studies that show that, within one generation of African immigrants, migrating to the United States, birth outcomes are significantly worse for that second generation. So what causes that? So just better understanding what influences our changes within our genetics that impact birth outcomes is also something that I think about often.
Yeah, and I think it's worth thinking about it. And one other thing or factor that I think that underlies a lot of what you talk about is just like stress and the stress that people of color have to deal with just generally, and how does that impact genes and outcomes and things like that. But that's very, very important in considering how we're thinking about the ways to solve these issues.
Sure.
And now, shifting a little bit, we hear a little bit about your background and the ages of maternal health, but broadly, what does public health mean to you?
That's a big question. To me, public health is beyond just the absence of disease. I think for me, public health is a state of like physical, emotional, social, and financial well being for people to be able to live and thrive in the communities that they are, residing in. They have to be able to have like some level of self-fulfillment and actualization. And through their health, I think it's important for us to, like, when we define health, we often look at it from like a Western lens. But for me, health is, more than that. How does the individual define health for themselves? The way that I would define health might not be how someone else defines health. And from public health, we're always looking at disease prevention, reducing the burden of disease on a community. So really public health is, how are people doing generally in their life, not just their like absence of them not being sick. Are they okay financially? All of that impacts their ability to like fight off diseases, fight off illnesses. Are they eating nutritious foods? If someone doesn't have a grocery store that stocks produce regularly, they probably won't have a lot of produce in their diet. Sometimes there are landfills near people's homes. How does that air pollution impact their overall health? Socially, are people isolated? COVID, we saw that a lot. There was an isolation epidemic. People were like loneliness epidemic. People were isolated. They were missing human contact. That has a negative impact on their mental well-being, which in turn has an impact on their overall physical well-being.
Quick break. Come join the public health community with a 7-day free trial. You'll get access to learn, navigate, and transform your public health career through mentorship, coaching calls, resume, cover letter, and LinkedIn workshops, exclusive videos from yours truly, and much, much more. If you've been looking for career support, mentorship, or want to build your brand, look no further. Join the public health community today for a 7-day free trial at thephmillennial.com/join or from the link below. Let's build a stronger public health community together. Now, back to the show. Absolutely. And maybe digging a little bit deeper into this and like your personal lived experience of being a refugee immigrant, how does that impact your perspective, or how do you come to the public health work with that perspective?
I think of it as living in two worlds at any given time. On one side, it has given me a genuine appreciation for understanding people's cultures and really empathizing, putting myself in other people's shoes and seeing, what causes them to have like a certain perspective on a condition, or the way they like hypertension. We could talk about like high blood pressure, the way it's defined by other communities. Things like depression, stress might not necessarily be associated with that. Think about like my immigrant refugee, like my family, like where I come from. People don't necessarily make those connections. So that's like one big benefit of being able to think in two worlds at any given time. And then more broadly, there's a lot of health challenges that immigrant refugee populations face, whether it's access to resources, limited financial capacity, getting access to healthcare facilities. There's the language barrier, there's cultural barriers. And that's something that I try to work towards bridging, really creating understanding between public health institutions, agencies, organizations, and the communities that they're serving.
So you got your bachelor's degree in global studies and a minor in public health at the University of Minnesota. Walk us through that process.
In college, I changed my major, I think 3 times within the first 3 years. So each year I was trying to study something new.
What did you go in with as?
Education. So I started off in the College of Education and Human Development. I wanted to be a teacher. My dad has a background in education, and that's all I was ever really familiar with. I thought it was amazing. I loved working with students of all ages. So I thought, let me do education. But while in the program and taking my generals, I started taking like more humanities classes and more biology classes. And that kind of inspired me to maybe rethink my original decision because I was really leaning heavy towards like the humanities, understanding different cultures. I grew up in Minneapolis. Minneapolis is a big city. It's the biggest city in Minnesota, but the community I come from, it's kind of small. But I've always been like a global thinker. I loved, connecting with different people. I loved the idea of traveling at a young age. So when I discovered that there was a global studies major, I was reading the course requirements, what it took, what it required, what the different tracks were. And that's kind of where I found my natural fit. I think that brought together like the learning and the teaching piece. I could do so many different things with that. I could even go back to teaching if I pursued that. I could pursue, public health, which I would eventually realize is my passion. And then that led me to also do a public health minor.
How do you get into the public health minor?
So I did a program through the university. It was called Health Ambassadors. They had a partnership with a hospital, and students could volunteer on different projects. For the Health Ambassadors program, I would volunteer at a community site where they did health education for Somali elders. They would do blood pressure screenings. They would educate them about, medication management. And then they had some like innovative therapies. They would do things like healing touch, and they would do exercise classes for elderly people who are English is not their first language. And as a volunteer, like seeing public health work on the ground really inspired me. And as soon as the semester started back up, I ended up declaring a public health minor and kind of deciding this is what I wanted to do. I saw that, the same people kept coming week after week to the same community site. And the way they interact with the nurses, the massage therapists, the pharmacists, it was truly inspiring.
Love that, love that, and I'm glad that you're able to come on and share that because as we shared earlier, like I didn't learn about public health until late into my journey, and I wish that I was able to get exposure and know the word for it so that I would be able to maybe streamline that process a little bit. But nonetheless, we are here, and that I think that's the beauty of people's journeys. It's like there's no one way to get and do the work and find your way into public health.
Sure.
And did you have any experiences that you wanted to share about during your undergrad?
Yeah, during my undergrad, I think right before my senior year, after I had declared global studies as a major, after I had declared public health as a minor, I did a study abroad program in Tanzania for the summer before my senior year. And this program was focused on medicine and public health in Tanzania. So looking at their healthcare systems, this included us going to like a training site and sitting in on various lectures by a pediatrician and then also a health advocate. And then as a part of this course, we also did site visits to a pharmaceutical dispensary. We were able to tour maternity wards. And then I also got to volunteer at an orphanage where there were, majority of the children had parents who had passed away to HIV/AIDS. And as part of that program, it really kind of honed in my passion for global maternal health and bringing, what I learned through that experience to my future careers. And I think that is why most of the positions I've had have been geared towards improving the health and well-being of families and children, kind of seeing that like firsthand experience.
And how did you develop maybe that interest for maternal health at this point? Was there any incident or anything that yeah, how did that come up for you?
Yeah, visiting the maternity ward and seeing some of the issues that these mothers were facing, many who maybe wouldn't even survive past the age of like 40 because they were HIV positive or because of lack of resources. They were in a very low resourced area. This was in a rural setting, and that really that sat with me very heavily. It was an issue that I wanted to solve, but at the time, being in my late teens, early 20s, I didn't have the right tools to be able to solve it, and that kind of inspired me to go on this journey of gaining more education, gaining more knowledge, building my resource reserve so that I would have something to offer and that I could have the capacity to potentially solve some of these issues. I think that all kind of culminated in why I chose this path and why it's something that I hope to continue pursuing as my career develops.
And were there any big undergrad takeaways that you wanted to share with us?
I think that was the biggest one for sure. And then just, bit of advice to undergraduate students that they don't necessarily have to have everything figured out all the time. It's a process of learning. That's why, they're there in a university or college setting. It is an opportunity to really kind of step outside yourself. That's how I like to think of it. Like step outside yourself and view the world as like third person perspective. You have all of these options in front of you. You have the ability to reach out to so many different professionals, even, coworkers, classmates, whether you have a part-time job, you have people in your class. There are some people from a very young age who know exactly what they want to do. And then there are people like me who took a little bit of time to get to where they are. So just be open and honest with yourself. If you don't really know what you want to do, take a little bit of time to explore and ask yourself those questions.
Yeah, absolutely. Plus one to that. What was your job after you graduated undergrad?
My first job was at a community clinic. It was Community University Healthcare Center. And at that position, I was a front desk patient services representative and then also a MNsure navigator. So I would help patients, appointment scheduling, making sure that their appointments across the different departments of the clinic were in sync, if they had medical, dental, or physical appointments, and then also helping people apply for insurance and then helping them triage any issues they had with their insurance.
Okay. And then were you in the role as an educator consultant?
I moved from that position to at that point, I had transitioned from working at the clinic to Hennepin County. And at Hennepin County, I had two different positions at two different times. Initially, I started off as a community health worker and regional coordinator doing immunizations outreach. A lot of the work I did was working closely with other jurisdictions in the metro area, looking at immunizations rates for childhood immunizations, and then doing outreach to community to help kind of increase those immunization rates and where we had pockets of disparities. And then after that role, I transitioned to another position within the county as a senior planning analyst, and this was in the public works department. That position, that was my first kind of exposure to managing grants and contracts that were going to community, and also experience working with clinical data. So looking at lead poisoning prevention, results from children, and being able to kind of work with community organizations so that they could craft programs to work with those communities that were experiencing this disparity the greatest.
Maybe how did you overcome if there was a learning curve around managing grants and doing that type of work?
Lots of trainings, how do you manage a budget? How do you do financial audits? And then also asking a lot of questions and working closely with the community to learn more about what their internal processes were. A lot of these were local nonprofits or community boards. So just asking a lot of questions and leaning on coworkers who had previous experience with this work, what their best practices were. And I'm a very process oriented person. So just making sure that I had a good understanding of what the processes in place were. And then also looking for opportunities to improve those processes.
And then after this role, you shifted into educator consultant through your role at King County. So how do you come across that and what do you do?
Yeah. So that was really interesting transition because that program was under the same grant funding that the Hennepin County position was. So it was a childhood lead poisoning prevention grant. And that was very interesting because seeing how federal funds allocated to two different counties were operated, how one program was leaning very heavily on community education and housing rehabilitation, and the other one was more focused on training and development and working also with community organizations. That was a common thread between the two. So in that role, I did something very similar, but it was a little more expanded, looking at environmental exposures as a whole. So like radon, looking at household chemical use, lead was a big part of that as well. And even lead in products. How are families being exposed to lead in products that were maybe imported? So that was a really good experience. I was very fortunate enough to work with such a great team, and working in environmental health, that I think really showed me the impact that early exposures can have, tying it back to maternal health, how early exposures, in utero or even very small children, can have an impact on maternal outcomes, whether that's, with lead, it could be low birth weight for children. So, yeah.
Yeah, that sounds like really, really cool work that you're able to work on there as well. And then I believe after that role, you moved into your current role as an internal consultant three in health equity at a health insurer. So can you tell us more about that transition?
Yeah, in this role, I have the opportunity to work at the very front end of developing strategies and initiatives that are geared towards addressing health disparities within our insured population. At this company, I'm working mainly on hypertension and mental health, looking at indigenous populations, Black populations, and then rural communities as well. So it's still kind of continuing the theme of addressing health disparities, but now I'm kind of working towards, how do we develop those initial strategies? How do we build a program that is really going to address these disparities from the very beginning to implementation?
And what are some of the challenges that you might see in that work?
I think some of the challenges are identifying who these populations are, which for me is about public health data, access to public health data, being able to have very accurate public health data, and then how do we understand that public health data? What lens are we using to interpret some of the information that we have access to? And how do we equitably respond to what we're seeing in our membership? I think that's somewhat of a big challenge.
And I guess a little bit tangentially, this role is on in the West Coast, but you live in Minnesota. How has that come across for you?
Yeah, so I used to live in Washington. I would say it's I have to think in two minds. Again, I'm living in Minnesota. Physically, I go to school here. I'm in this community. So I see this population. I'm familiar with the population of Minnesota. This is where I grew up. But then, when I'm in Washington or I'm working on initiatives through my company there, I'm having to think about those populations, which are, oftentimes very different. They're not the same communities. They don't have the same needs. So that's how I kind of manage that in a way, just making sure that whenever I'm applying a lens, I'm thinking about it from, what resources exist within that community versus what resources exist where I am. And if I see something in the community that I'm in, thinking, okay, how can we implement or replicate something like that to be able to reach this population that might be beneficial?
So thank you for sharing that because that I was
Yeah.
curious about. And do you work on West Coast times as well, or?
Yes. Yes, I do work on West Coast times. It's a bit flexible at times, but yes, it's a 2-hour time difference. It could be challenging towards the end of the day, but it's not too bad.
Fair enough. Fair enough. You got to do what you got to do. And then when you graduated with your global studies and minor in public health degree, what at that point, what did you like maybe envision for your future in public health, or what was the idea of your career at that point?
Yeah, I thought I was going to be a global diplomat. A lot of the people that I went to school with were very interested in world politics, how different countries interact with each other. I was approaching it from a health lens. So I always have that public health, somewhat blinders maybe, or a public health lens on, where I always see things as like, where are the opportunities to improve people's health? So, now looking back, I think adding the public health minor was very smart choice, because I was able to apply what I was learning in my classes to, what I wanted to be doing in the future. So,
And as you shared earlier, you are a current graduate student. You're a Master of Public Health student at the University of Minnesota School of Public Health. Walk us through that thought process of baby, because I'd imagine that you were working and then you applied to do the job. So, like, why at that point? Why did you make that decision to pursue an MPH?
Yeah, I decided to pursue an MPH because, in my career journey, I feel like I hit somewhat of a ceiling when it comes to pursuing public health careers. I wanted that background knowledge on the very technical aspects of public health education, public health programming. So for me, it was a personal choice to pursue a master's degree. But also, my master's is focused on maternal child health, and I'm doing a global health minor as well. So that for me, that is honing in on, what exists in the public health or maternal health world. And then choosing the University of Minnesota, I went there for my undergrad, and it seemed like a natural fit for me. I was somewhat familiar with their School of Public Health. I had friends who had gone to the School of Public Health there. And then I did a lot of research on the professors who were doing research at the university. And, we have some really great world class professors in the maternal health world. We're very lucky in Minnesota. I think the public health community here is very strong. So those are some of the decisions that went into me pursuing a master's degree. It was about, career progression, more knowledge, being able to really solidify my interest in maternal health through that formal education.
And are you doing this part time, full time?
My program it's a hybrid program, so it's virtual, but there are a lot of the classes have online option. With my job being in the West Coast, sometimes I can kind of flex and have morning classes or online classes. So it's a little bit of both. And I'm in an advanced standing program because of the work experience that I have. So it's a little bit of there's the courses are somewhat condensed, and we take less credits as advanced standing students.
And as you're someone that is working while doing your MPH right now, what value do you say that brings to your experience in your MPH program? Or vice versa,
Um,
either way, to MPH program or to the
yeah,
work you do?
yeah, that's something I think about a lot because for me, pursuing a master's in public health, I wanted a program that gave me a combination of both like practical and applied knowledge. Practical and technical knowledge, having the academic background, but also being able to apply it in a real world experience. And I believe that's one advantage of, I have over like 8 years of experience, nearly 10 years of experience now in public health. And coming back as a graduate student, I see that it's very beneficial in classes that require like discussions around management and public health entities. I have more familiarity with what healthcare systems, what some of the challenges are in healthcare systems, what some of the challenges are in governmental organizations, than someone who maybe doesn't necessarily have that experience. So to me, it's been a wonderful combination of bringing together my academic interests and my practical like technical skills. So.
Absolutely. So, would you say you're an advocate for working and doing MPH program?
Not necessarily, it depends. I
Okay.
think there's some programs that require a lot more like hands-on. My program, I'm just lucky enough where they offer a hybrid option, but there are some programs where it's completely in person. They don't really have an online option. So for individuals like that, I think that's a sacrifice or discussion that they would have to have to make that decision. But I do believe there is some benefit to having work experience before you pursue your masters, or even during your masters, maybe during the summers, or if you can do an internship while you're pursuing your masters, because a lot of programs they do offer internship opportunities while you're completing your program, and that's sometimes even a requirement. So I think it's personal preference, but also what your capacity is as your program decision as well plays a factor.
And I don't particularly like the word like work life balance or the phrase work life balance, but how do you have tools, techniques, ways that you are able to balance work life and all the things?
Yeah. I don't like the phrase work life balance either because it's somewhat separating the two. I think it's hard to separate the two in our field, public health is very heavy, and sometimes it's hard to step away from what you do day to day because you see it showing up in the world you live in. So you walk outside, you can identify like disparities that exist in the populations that you see. So it's like having a true work-life balance. Like the work doesn't stop at the door when we clock out at 5 p.m. or before we clock in at 8 a.m. So for me, I think it's important to have hobbies. I think that's one thing that I would encourage everyone to do is cultivate your hobbies. It's really important to have things that you like that are not related to necessarily your work or even school, things that you really enjoy, and making sure you're spending time. And if you're doing those things, that you're growing and developing um, areas in your brain that are like that bring you joy and comfort. So I like reading. You see some books behind me, but I also like exercising. I really love working out. I really love, hanging out with my friends, exploring new coffee shops. I love going to plays. All of those things kind of contribute to helping me balance my job and then also my personal life.
Yeah, absolutely. And I think we don't talk about enough the challenge that it is, even being like not only like a public health professional, but an MPH student, and just being a part and learning about health disparities, and that's just being a part of what you're talking about day in and day out. And like to your point, then from learning that, then you're living in the real world and you kind of see those same things. And we don't talk about how that impacts, I don't know, public health professionals. Maybe someone should do broader studies on that. But I think this is important. And then, like to your point, like understanding how do we manage all of these things and live a life where we have hobbies and we have interests that may have no relation to public health or the work that you're doing, because these are things that are also just important for us to live healthy whole lives.
Yeah, I think it's turning the work we do internally, because our definition of health kind of shapes even how we conduct our life. Because for me, health is about like so many more things. How do I define public health? Physical, social, emotional, financial well-being, and then making sure that I'm taking care of myself in those areas of my life so that I can have optimal health as I've defined it. And then you can bring that outward. Like it's easier to be able to educate communities when you have a solid understanding for what you define as like a healthy life.
Right. And I think like to that point, there's no one healthy life. It is really determinant on you and what you see as important to for yourself, actualization, health actualization.
Yeah, sure.
And before we move on, you did say that, and I know that you're going to make some recommendations for books in at the end, but was there any book that you're reading this year that stood out to you? It doesn't have to be anything public health related.
Ooh, that's a good question. Yes. Um, this is a book that I've been reading for a while. It's part of my recommendations, but it's also a book that I've just continuously read because it's so heavy and it's like a really big book. It is A Medical Apartheid by Harriet A. Washington, and it's a book about like medical research, medical procedures, and the dark history of how those medical situations kind of came to happen and who the individuals that were being tested, poked and prodded were, and how, things we consider now as being so novel and, these are everyday procedures went through like a very dark history of being tested on Black and Brown individuals. So it's a heavy book, but it's definitely a book I recommend. And I read it in chunks every now and then.
Yeah, I think that's always recommended to read, because to the point of earlier, it's a lot of hard information to kind of just take in, and you really do need some time to just break from that information sometimes.
Yeah. And for me, I'm interested in research. I've participated in some research and I'm currently on a couple of research projects, but it's all about like ethics, the ethics of research, the questions that we're asking, and then who are the subjects in our research or like our sample populations, and making sure we're always taking an approach of, these individuals are like they are valuable. Like, we're not just extracting information, we're always closing the loop on information. What we learn from community, we can synthesize, publish papers, come up with really pretty graphs on health outcomes, disparities, but making sure that we're sharing the information back with community members. So that's something that I think about quite a bit. Like, how do you conduct ethical public health research?
Yeah, that's absolutely very, very important, and to the point of like so many communities feels like they've been extracted from
Yeah.
researchers. So it's how do you really come in and do that ethical research and do that maybe community driven, community led type of research, which is so important. I think, especially when we're talking about communities that have been most marginalized historically. And before we move on to the Furious Five, where would you like to see yourself in the future and where can people connect with you?
I see myself in, gravitating more towards academia and research, but also working on, similar to in my current role, working on developing public health programs that address disparities at all levels and tackle those system levels issues. And people can connect with me on LinkedIn, Najma Dahir. You will see it says internal consultant at my company. And I'm on social media. It's more personal there, but definitely feel free to connect with me on LinkedIn, email. Happy to share my professional email as well.
Thank you. And as you're thinking about a future in academia, is a PhD or a DRP something that you've been thinking about or not so much as yet, maybe?
Yes, actually. So I'm on track now to starting to apply to PhD programs. My goal is to do a PhD related to population health and global health. So, and then hopefully maybe do a concentration somewhere in there on maternal health. But yeah, I definitely see myself doing a PhD. My very long-term goals eventually would be to teach in academia. I think, as I mentioned before, the two things that I think I bring are, having the practical experience of working in public health jobs, having that hands-on experience and knowledge, and then also the academics. As somebody who's graduating in a few months, thinking about all of the skills, the knowledge that I'm learning, taking epidemiology, biostats, very core competency classes for maternal health. How can I apply that to whatever field I decide to work in? But part of what also is motivating me to pursue a PhD is the research aspect. I think public health research is a area that I'm starting to notice that I have, growing interest and wanting to, lean more into that.
But we look forward to seeing how that journey turns out to you. Good luck for the rest of your MPH program and into the transition of a PhD program.
Yeah, thank you. I appreciate that.
You're most welcome. And moving us on to the Furious Five, the 5 questions that I ask all guests. So, number one, what advice would you give to a student trying to pursue a career in public health?
What advice? I would say be open to opportunities and be vocal about your advocacy. If there is something that you are passionate about, be very vocal in addressing those issues because, if you're not able to speak on behalf of the communities that you're looking to serve, the issues that you're looking to address, other people won't really know. And then I think it's important for us to have like a common understanding, common language when we talk about health disparities and population health level issues. So being able to advocate for these populations, I think is really important. And then just being open to opportunities. I'd say I've kind of fallen into some of my jobs, and each one has been a profound experience. It has given me so much knowledge in these areas. I've been able to grow and develop as a person and also as a public health professional.
Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
I would say network. I know we hear that a lot. Networking, it's not about what you know, it's about who you know. But I would say it's a little bit of both. I think what you know is equally as important, especially in public health. But networking is not just for job opportunities, but I would say also for your career development. The public health world is big. There are so many different areas, so many different topics, But for me, it was honestly just reaching out to different people, doing informational interviews, really trying to understand what the job required, how my individual skills would fit, and then using that to make me a stronger candidate.
Number 3, what's something you're working on improving in your life right now?
I'm working on listening more and talking less. And I think that's very important for the research work that I'm doing because we're often going to community for their experience and we're going to community for knowledge. So being able to truly listen to what the needs are and bring about changes that the community will be happy with, making sure that our research is ethical. That's something that I'm really working on. Is just listening more, really seeing what people are saying.
Number 4, professionally, do you recommend anything?
Yes, I have a list. I have a very long list of resources, especially for maternal health. As far as books, I would definitely say it's not maternal health related, but Medical Apartheid, The Body Keeps Score. I think that book has a lot of great information about the adverse effects of trauma on our physical, mental, and psychosocial well being and how that manifests in our health. From a public health perspective, I think it's a really wonderful book. And then as far as podcasts, there's this podcast I would highly recommend. Anyone who's looking to explore a public health field, tune in, reach out to the different people. You may never know where opportunities will come from. And then there's one documentary I think that really touches on the issue of maternal health in the United States and the crisis that we're facing. It's called Aftershock, and it's the real life account of someone who experienced a person in their family die because of issues that could have been resolved or unnecessary consequences. So I
Mhm.
think those are some of the top 3 for me.
Appreciate you sharing that. And feel free to share the maternal and health list, and I can share that out some way or another with people as well.
Yeah, I'll definitely do that.
Awesome. And then last but not least, if there was one piece of advice you'd give to your younger self, what would it be?
Make time for your hobbies. I stated this earlier, but cultivating things that you enjoy and really holding them sacred is so important. It's good for your mental well-being, it's good for your social well-being. Through hobbies, you can meet people, you can find things that you genuinely enjoy, really understand who you are as a person, but they will come to benefit you later on in life as you start experiencing like stress at work, stress in your personal life, stress in school, being able to go back to the things that you truly enjoy because you spent time cultivating them will be a saving grace.
Absolutely. Love that. Love that. Well, thank you so much, Najma, for coming on and sharing your story and perspectives and expertise. This was a lot of fun. I look forward to your journey in public health.
Thank you so much. I'm really glad that I was able to join today.
Yeah, likewise. It has been a pleasure. So, housekeeping items, everyone. Thank you all so much for watching or listening to this. Be sure to subscribe if you have not as yet. Leave a like, leave a review, and share it with a friend who gets some value with it. See you all next week. Peace.